Hello everyone, welcome to the Dubai's World channel. Today I'm going to start with a new topic that is tetanus. Now, what is tetanus? Tetanus is taken from a Greek word that means to stretch. And it was first described by Hippocrates and Susuruta. Actually, it's nothing but it's a neurological disease which is characterized by onset of hypertonia. Here, this hypertonia means an abnormally high level of a muscle tone or a tension, and it's characterized of onset of hypertonia, muscular contraction, and generalized muscle spasm. Here, the muscle spasm is also known as a muscle Here, the muscle spasm is also known as muscle cramps that are very painful and cause electrolyte imbalance in potassium, magnesium, and calcium. That will also called a muscle fatigue, which mostly involve in thighs, calves, foots, hands, or arms. So now we'll see the causal organism of tetanus. It's caused by Clostridium tetani. It's nothing but the cylinder-shaped gram-positive bacillus with the size of 2.4 into 0.4 to 0.5 micrometer. And that's bacillus is a pleomorphic in shape and non-capsulated. But if we will talk non-capsulated, and along with that it's a motile by peritrichid flagella. But if we'll talk about the type 4 strain of this Clostridium tetani, they do not possess the flagella, so they are not motile. And this Clostridium tetani produce two types of toxin. That first is a tetanolysis and second is a tetanospasmin. Here the tetanolysis cause a red cell lysis, but this tetanospasmin cause muscle spasm and rigidity. So now we'll talk about the classification of four different forms of tetanus. Here in the classification it's have four different forms. First is local, second is cephalic, third is generalized, and fourth is neonatal. Actually this local is a persistent spasm, means it will be a continue for longer time, and it's generally milder. From 1% cases it will seen, and it is very fatal but may precede the generalized tetanus. The local may precede the generalized tetanus. Affect mostly the cranial nerves. This affect mostly the cranial nerves and face nerves. But when we will talk about the cephalic tetanus, its primary site of infection is head injury. Or otitis media. Now, we will ask what is otitis media. Otitis media means an ear infection which is usually caused by bacteria. And here we can see this Clostridium tetani or bacillus, which cause this in cephalic form. It's caused a head injury or otitis media. This it's very poor prognosis. Third is the generalized. Generalized is the most common form, means 80% of cases are there. 80% cases are there, and this present with a descending pattern. This is important points for this. This is a descending pattern. It's associated with a descending pattern, and its first sign is lockjaw. First symptom or first sign of a generalized tetanus is lockjaw, whose due to the spasm of masseter muscles, muscles. It's caused lockjaw, and due to a spasm of Master's muscles. Master's muscles means facial muscles, and it followed by stiffness of a neck, difficulty in swallowing, rigidity of abdominal muscles. But while talking about a neonatal tetanus, it's a generalized tetanus that's occurring only newborn baby or infants. Occur in infants of non-humanized mothers also. Occur from an infection of unhealed umbilical stump, particularly when the stump is cut with a non-sterile instrument. After delivery, that umbilical cord, if it is cut with a non-sterile instrument, that may also cause this type of tetanus to newborn infants. And this is very poor prognosis. This shows very poor prognosis. These are the 4 classifications of tetanus. But while talking about the biochemical characteristics, this Clostridium tetani shows a proteolytic activity. In indole, it shows positive, but in MR, VP, H2S, and nitrate reduction, it shows a negative test for that. This Clostridium tetani also have HO antigens along with the spore antigen. Now, what is H antigen? Here, the H is flagellar and the O is somatic antigen, and along with the spore antigens are there. Here, the H is flagellar and O is somatic antigen along with the spore antigen. Now, we will see the pathogenesis of a tetanus. Actually, this Clostridium tetani is a ubiquitous bacteria, means ubiquitous organism, means it's present in a human gastrointestinal tract along with the soil. Other than that, it's present in a soil also. So, especially in a manured one. So, this Clostridium tetani enters the body from a wound. Enters body from a wound. But it stay in a sporulated form. Clostridium tetani enters body from a wound, but stay in sporulated form until anaerobic condition are present. Once the O2 level low in the surrounding tissue, this Clostridium sporulated form germinates under anaerobic condition into a new active vegetative cell and begins to multiply. Along with the multiplication, they start producing toxins. Here they produce both of the toxin, as I already discussed, the tetanolysis and tetanospasmin. But in that, tetanospasmin is more effective for a tetanus. That shows it's believed or it's proved that it's cause a significant cause of a tetanus. It's this toxins cause a tetanus. But if we'll talk about a tetanolysis, it is not believed that it's cause any significance in a clinical course of a tetanus, because it's only for red cell lysis. After the production of a tetanus specimen, it is spread using blood and lymphatic system. And bind to motor neuron. And then after it travel along axon the spinal cord along the axonal to spinal cord, and then binds to the site where it causes inhibitory of a neurotransmitter across the synaptic cleft, which required to check the nerve impulse. But if the nerve impulse cannot checked by a normal inhibitory mechanism, it's lead to unopposed muscular contraction and the spasm that are the characteristics of a tetanus. Once again I will repeat here. Once the Clostridium tetani enters the body from a wound, but it will stay in a sporulated form until an aerobic condition are present. But once the oxygen level is going to decrease, this germinate under the anaerobic condition into a vegetative cells and begin to multiply. After the multiplication, they start producing two type of toxins, that is a tetanolysis, tetanospasmin. Tetanolysis, it's believed that it does not cause tetanus, but it causes cell lysis, red cell lysis. But here the tetanospasmin that causes tetanus. That tetanospasmin is spread using a blood and the lymphatic system. Then it binds to the motor neuron. After that, they travel along the axon to a spinal cord and then binds to the site for a inhibiting skeletal muscle contraction. But once they bind to the spinal cord, it's block the release of a inhibitory neurotransmitter and across the synaptic cleft, which is required to check the nerve impulse. Means once this bind to the motor neuron, this inhibitory neurotransmitter is not able. It blocks the release of a inhibitory neurotransmitter across the synaptic cleft, which is required to check the nerve impulse. But if the nerve impulse cannot be checked by a normal inhibitory neurotransmitter mechanism, it leads to a unsupposed muscular contraction and inhibiting the skeletal muscle contraction. As you can say, the travel along the axon to a spinal cords, then bind to the site responsible for inhibiting skeletal muscle contraction. Then the tetanus toxin, how it will act? It blocks the release of inhibitory neurotransmitter, that is a glycine and gamma aminobutyric acid, across the synaptic cleft, which is required to check the nervous impulse. If the nervous impulse cannot be checked by a normal inhibitory mechanism, it leads to unopposed muscular contraction and the spasm that are the characteristics of a tetanus. Then we'll see the symptoms. What are the symptoms of tetanus? After the entering of a Clostridium tetani, after the action of a tetanus, this can be shown that muscle spasm affect the larynx, cause asphyxia, and then stiffness of a jaw that may be called as a lockjaw. This disease is also known for a lockjaw. Then contraction of a facial tissue and the fast pulse and maybe fever. But if we'll talk about the clinical feature, the IP is incubation period is 7 days to 21 days. Here, if the shorter of a incubation period means if IP is less, shorter of the incubation period, higher the chance of a death. Higher chance of a death. And symptoms are symptoms this is shown during the incubation periods are the, as I already said, the muscle spasm. But the early symptoms are neck stiffness and the poor mouth opening. But if the muscle rigidity spread to descending pattern to limb, this will cause, as I said, this is also called as a lockjaw. This is the lockjaw, also written as a trismus. A spasm of a master muscles means a spasm of a facial muscle. Spasm of a facial muscle. Now we'll see the diagnosis. Here in the diagnosis, it's not given evidence that blood test is required for a diagnosis. Means the blood test never shows the presence of a tetanus, but it is demonstrated by presence of a trismus, means a presence of a spasm of a facial muscles, and with the direct smear by showing the gram positive bacilli with a drumstick appearance by taking a specimen from a cerebrospinal fluid. That is appearance that will shows the during the gram positive staining, gram staining, it will show the bacilli with a drumstick appearance. Or then we can also do the culturing of this. It will done in a blood agar. Here the gram stain is done in blood agar under anaerobic condition. This will produce swarming growth in a 1 to 2 days of incubation. Our other method is animal inoculation. Animal inoculation. Here to demonstrate that this will done for to demonstrate the toxigenicity of tetanus. If a positive case is there, the stiffness and the spasm of a tail inoculated hind limb within a 12 to 24 hours, which is spread to rest of the body. Means in positive case, it in an animal it will show the stiffness and a spasm of a tail of an animal, and which will spread to rest of a body in 12 to 24 hours, and that may cause death occur in a 1 to 2 days. And one is most important test for this is a spatula test. This is important or a very simplest test to test the orphan with a spatula or a tongue blood. If a negative test, if a person is not having a tetanus, they will show the result like a test elicits a gag reflex. Here in negative test it shows gag reflex, and patient try to expel the spatula. But if a person having a positive means is a person having this tetanus, patient develops a reflex of a spasm of master and bite the spatula. One who do not have this, they will show the gag reflex, but if person having, they will show the reflex of the spatula and they bite the spatula. This tetanus carries a 35% of a mortality rate. So it should be important to take a prevention before this tetanus. Here in tetanus there is 3 types of prophylaxis. First is a surgical prophylaxis, second is a antibiotic prophylaxis, and third is a immunoprophylaxis. In the surgical, include the promote and adequate wound cleaning and removal of a foreign material. Like if someone getting a cuts and with the contaminated blades or a razor, it should be clean before the blood. It should be clean, and the removal of a foreign material and the blood clots after the cut. This ensures the elimination of bulk of a contaminating microorganism is removed. But in an antibiotic prophylaxis, a patient may get administration of an antibiotic that will destroy or inhibits the Clostridium tetani. Here the antibiotic is given is like a erythromycin 500 mg twice daily. However, if antibody do not affect the toxin, therefore antibody prophylaxis does not the prophylaxis replace the immunoprophylaxis. In the immunoprophylaxis, active immunization should be given, or a passive immunization. Means at the birth, newborn baby, they may get the active immunization with the. In immunoprophylaxis, they should be given active immunization and the passive immunization. In active immunization, they can get DPT vaccine, and in passive immunization, they may get injection of TT. In DPT is a diphtheria, pertussis, and tetanus. This vaccines combination of 3 types of vaccines: diphtheria, pertussis means whooping cough, and the T for tetanus. And in passive immunization, it can give the injection of a TT. It's a antitoxin, tetanus antitoxin, often called as a anti-tetanus serum, ATS. Can be obtained from the horse immunized. But if we'll talk about the treatment of this tetanus, is can be treated by neutralization of unbound toxin with HTIG or a ATS. Prevention of further toxin production or a wound debridement with the antibodies. So it can also give